6.1 FM. It's that time of the day again. Yes, of course, every Monday at 10:15, it's always time for us to bring you information, of course, that will benefit you. Yes, as regards your health. Yes, you know, health is very important. Good health, for that matter. So we bring to you Ilera Eko Extra right here on Lagos Traffic Radio 96.1 FM. Of course, this show is powered by the Lagos State Health Management Agency, LASHMA. And on this show, we bring you information, we bring you tips, and every other thing in between that will help you access quality healthcare at minimal cost. My name is Akan Usen. It's my pleasure to stay the shape of the show. Of course, we'll be taking this up until 11 o'clock. Stay with me and don't touch that dial. Of course, as the show progresses, we'll be giving you traffic feeds. I have this one as regards the earlier reported broken down truck at mile 12 in North Koshore Fair. At this time, I understand it has caused a backlog of traffic, which has gotten all the way to Odogun. But the good news is that it is now off the road. It's now off the road. The broken down truck at mile 12 in West Koshore Fair, which backlogged traffic all the way to Odogun, is now off the road. So what the traffic managers are doing is they're trying to, manage the backlog, see how they can flush things. Okay, so before I introduce my guest on the show, would of course throw a quick one. Yes, a quick birthday shout out to the Permanent Secretary, Office of Chief of Staff, Mrs. Adenike Ganiata Kombi. Of course, I understand she's marking her 60th birthday and she's retiring today. Wishing her God's continuous guidance as she exits the Lagos State Public Service. And this is from the entire staff of the Office of Chief of Staff. All right, back to Ilera Eko Extra. Today we have it's a double-decker edition. We have two very special guests in the studio with us, and we have a surprise. Yes, we're going to be doing some giveaways, so get your phones ready. Get your phones ready, because the first two callers on the show will go home, or rather, you might be at home, you might be at the office, but you'll definitely be getting something really special. So my first guest on the show today is a voice I'm sure you've heard before on the show, so it will not be a surprise having her on the show again. She is Mrs. Ogumushire, Enrollment Officer, LASHMA. You're welcome. You're welcome.
Good morning. Thank you so
much. Good morning. I hope traffic wasn't so much coming in.
Well, I was coming from Ikorodu, so it was much.
It was much
earlier. Yeah.
Okay. Thank God for that. Yeah. I don't know, maybe you encountered that impediment. Maybe that was part of why you encountered that slow movement.
Yeah, I think so.
Coming in.
Yeah.
All right, it has been moved off the road. So, dear listener, if you're coming in that from that direction, things will definitely ease off. I also have with us Mr. Rufus Bankole Adeyanju. He is an enrollee under Ilera Eko. Mr. Adeyanju, can I call you that? Yes, you're welcome. You're very welcome.
Good morning.
It's great to have you on the show.
Thank you very much.
Yeah, so we're so glad you could take time out of your busy schedule to come, grace the show today. And I'm sure a lot of Nigerians, or rather Lagosians, would love to hear from you. It's good to hear from the horse's mouth. It's one thing for someone to say, take this thing, do this thing. But, when you say, I am using this thing,
no scam zone.
No scam zone. I love that. That's the beauty of it. So we're going to get first-hand information from one of the enrollees. He's going to give us his testimonial, and we take the show from there. So straight away, we would be just going into this. I will be starting with our enrollment officer, LASHMA, Mrs. Womushiri. Can you tell us about the Ilera Eko health insurance plans that we have? Possibly tell us what Ilera Eko is, for the benefit of those who perhaps do not even know what we're talking about. They'll be wondering, what are these people saying? So let's start from the very nitty-gritty. Tell us what Ilera Eko is. Let's touch on the plans that we have under the scheme, and possibly pricing. And maybe from there we'll go on to what they get to enjoy under every of these plans.
Okay, Ilera Eko, as well, I've said earlier, I think I've been saying it for quite some time now. I'm not the only person.
You say it all the time.
I know people have been listening to us, but some of them have not really grabbed what Ilera Eko is.
Yes.
It's a social health insurance that was created for every indigene in Lagos State. Yes, it is. So it's we encourage people to go into it because it's pocket friendly. It's pocket friendly. It's something we can afford, both the rich and the poor. So it helps us to reduce sometimes no payment for our medical bills.
Okay. So what are the plans we have on the scheme?
We have 7 plans.
7
for
plans,
now.
okay.
For now, we have.
For now, meaning
for now,
more could come.
Yes, more could come.
Okay.
We have the standard plan.
Okay.
We have the standard plus.
Standard plus.
We have the tertiary plan.
Tertiary plan. Okay.
We have the student plan. We have the diaspora. We have the telemedicine.
Okay.
We have the seniors plan too.
Okay.
Yes, so that's already 7.
Okay.
Now for the standard plan, if you want to do standard plan, we have that for individual and for family.
Okay.
The individual is 8,500.
All right.
Then the family is 40,000.
All right.
If you're paying instrumental, you could pay quarterly or you could pay semi-annual. Semi-annual is 6,000 for individual.
Yeah.
Then if you're paying quarterly, it will be 3,000. Immediately you do the first payment, you'll be activated the next month and
Okay,
you
the
start
next
using
month.
it.
When you say the next month, could you explain that?
Yes, if you pay today, say for example you register and you enroll immediately, this month you're going to start using it by April, first week of April.
Okay.
Precisely, yes.
All right. So anyone who pays later than that date you mentioned.
If you pay 26, you're still going to wait till March. Once you skip the payment deadline is 25th of every month.
Okay.
So if you miss it, you have to wait twice the month.
Okay.
Yes,
Okay.
yeah.
Okay.
Then we have Standard Plus plan. Standard Plus plan is higher than Standard plan.
Okay.
That is 70,000 naira.
Okay.
So if the individual is 15,000, if you are paying instrumental, it's 18,000.
Okay.
If you are paying instrumental 2, it's a 2,000 increase.
Okay.
But any amount you start with, as in the instrumental payment, once you make the payment, you start using it. Yes. Then we have the student plan. The student plan is for those in primary, secondary, and it's broken into 3: first term, second term, third term, 2005, 2005.
Okay.
So the sum total will be 75.
All right.
Then we have the tertiary also. We have the telemedicine. The telemedicine, you don't need to come to the hospital.
Wow.
You just have access
From the comfort of your home.
Yeah, from the comfort of your home. You just have access to a doctor. You still have a policy number that is 3,000 naira. Then we have the seniors plan. The seniors plan is for people above 60 plus. That they have access to. But that senior plan, you don't have to pay instrumental. You pay outright.
Okay, you can't pay instrumentally.
No, you can't pay instrumental.
Okay.
It's an outright payment.
Perhaps is there a reason for this?
Yes, because they have access to what's it called?
Okay, so maybe it's checkups.
Yes, complete checkup for them. Yeah, annual checkup every year.
Okay.
And so those checkups are quite expensive, and the plan is a bit cheap. It's just 34,000.
Okay.
And for husband and wife that's couple is 65,000.
Okay.
So that annual plan, they will be referred to a diagnostic center where they can have those tests.
All right.
Yes. Then we have the one for diaspora.
Diaspora, okay.
Yes, people abroad that want to buy for their people, or people flying in that want to use the scheme. Yes.
Okay.
Thank you.
Oh, great. Okay, so before we, I'm going to be asking you a few of the benefits that we'll get to enjoy, but I would like to talk to our friend in the studio with us, Mr. Rufus Bankole Adeoju, who of course is enrolled under the scheme, under one of the plans. So I'm curious, how did you hear about Ilera Eko?
Okay, good morning, Lagos.
Good morning again.
I think it was sometimes 2021.
2021, okay.
Yes. My my wife got home and told me about it.
Okay.
I think one of our colleagues from work.
Okay.
So when she got home, she said, guys, because then she was already pregnant.
All right.
So she now said, considering the cost of the
Delivery and all that.
living and all that, delivery and all that, because you know in Nigeria now we know what is going on.
Yeah.
She now said there's what we call Ilera Eko. I said I don't know what is called Ilera Eko. I have not heard about it. But immediately I was convinced to some extent. And I went to, because I live in Jakonde Estate.
Yeah.
So I went to Ikotun center thereabouts that covers that area. So I spoke with one Mrs. Steve.
Yeah.
So she made me understand the benefit of Ilera Eko.
Oh, okay. Could that be Mrs. Steve Sonny? Could that be? Okay.
Probably.
From the Cotton.
Yes, from the Cotton district.
Yes. All right.
So it was later I paid. I did family.
The family plan. Okay.
40,000 naira per year.
Okay.
So when she.
That's a standard or standard plus.
Probably standard or something.
Okay.
I know I paid.
Standard plan.
Standard plan. Okay.
I know I paid 40,000 every year.
Yes.
So when at first we registered at a private hospital,
Yeah.
very close to our estate. But as time goes on, a friend of mine who have been enrolled under Ilera Eko for quite some time now told me that the best thing is to go to a government-owned hospital. I said, I don't really like their lackadaisical attitude. Blah blah blah. You understand? So I was convinced to some extent.
Yes.
So we now change from that private hospital to Isolo General Hospital.
Okay.
Because our estate is very close.
Quite
to that.
close. Okay.
Yeah. So it's just a stone throw.
Oh.
So when we got there, in fact, it was just the turnout and the response from the doctor, the nurses was massive.
Wow.
Anytime they see him, probably if we are going for any test or we are going to any ward, probably there is this folder they gave us.
Okay.
I think it's a brown folder or something,
Okay.
purple folder.
Yeah.
Anywhere you go to any department office, go to, they'll call you government picking. So they give us probably
So
under Ilera Eko
there's a
preferential
preference,
treatment,
priority.
Yeah, priority. That's the word.
Wow. Priority.
Because of the folder. Because the folder is different from the normal folder.
This is the first time I'm hearing this.
Yeah, that's the truth.
You now be carrying your folder with pride.
Then, of course, you are government, son now.
Oh,
so
great,
that's the benefit it comes with. They
Amazing.
attend to us swiftly without any delay. Then, in terms of payments, I think what actually happened is when she was due for delivery.
Yes.
So the baby came earlier than expected time. So
Okay.
the baby was on incubator for a while.
Yeah.
So there are some things I was scared of. So the doctor told me that I don't need to be scared. I said, is it money? I said, sir, yes. He said, no, don't worry, you don't need to be scared. Since you are under Ilera Eko, it covers this, it covers this, it covers it. Then I keep calling Mrs. Steve. I was asking her, Mommy, hope this thing will cover this. Hope this will cover. I said, Mr. Adeyanju, please calm down.
Because you know the cost implication
Definitely,
normally.
of course, medically it's not
Yes,
easy.
yes.
Do you understand? So she keeps giving me a first class hope. Let me put it that way. That Mr. Adeyanju, calm down. This and this and this and that. At the point I became skeptical.
Wow.
That is this going to be real or fake? So probably the first enjoyment, and there was a test we are meant to conduct on my son then. So they said we should go to FMC Butemeta.
Okay.
So when I get to because since the baby is on oxygen,
Yes.
so we have to go with an ambulance.
Oh, okay.
I wanted to put
Wow.
the HOD of the pediatric department said, Mr. Adeyanju, don't worry, it covers.
This is
You can go."
amazing.
So we left the Solo General Hospital to FMC Butemeta. Came back. I went to the accounting to go and pay. So they said, where's my folder? I said, my folder is not. You can bring my. Meanwhile, before I go back from Butemeta, the folder has been transferred to the accounting department, probably for finance or probably auditing and all that. I don't know.
Yeah.
It's an internal arrangement.
Yes.
So when I got there, they said, in fact, I met some guys crying that they wanted to make payments. Probably the stress, the amount and all that. But
And
they
all
said,
that.
no, you cannot pay that. There is this word, there is this particular woman, I've forgotten her name. I said, used to call us government picking. That's the word she used to use. So sometimes they became paranoid that they are not getting anything since we are paying directly to the government, or probably we've paid
already
directly to the government. You
Yes,
get?
yes.
Because those are the benefits it comes with. Then another thing is when she wanted to, what's it called? When she wanted to be discharged.
Yeah.
There is this, she gave birth through CS.
Okay.
So when they went to be discharged, most of my friends, probably, or most of the patients that are in that hospital, that paid, they pay huge amount of money. At the point I became skeptical
because of the procedure.
Because of the procedure, the payment. Well, you know, mentality of everybody is whenever they hear about CS, they feel, oh, do I have the money? Do I have the money? Do I have the money? But I called Mrs. Steve. I said, ma, this and they said, Mr. D. She was just laughing on phone. Sometimes she would not pick my call. Probably she was busy. So I became skeptical again. Why this woman not picking my call? I said, well, so I went to the Ilera Eko unit in that general hospital. I spoke with the people in charge. They said, they have to admit too. They said, why are you?
You'll be wondering why they're laughing at you.
You know, sometimes because that was my first issue. Do you understand? And that's my first experience with Ilera Eko. Though while I was in school, I have health insurance. Then, but it's a student insurance. No, this one is a family something. So from antenatal to postnatal and all that, they has been very, very good. Those, like I was saying, when she was about to be discharged. So the money the other patients pay for their wife or probably for their family was quite huge.
Was huge.
Do you understand? Was quite huge. I saw the receipt, I saw everything. So they gave me a receipt that you go and pay. In fact, I brought out my ATM. I wanted to pay close to 300-something thousand. I wanted to go and pay. So one of the accounting officers said, you are carrying a government folder. Go to the accounting department. Let them know which one you are paying, which one you are not paying. I said, probably that man is drunk. What is he saying? Are you okay? Because at the point, I was, I don't even know how to say it.
At that point in time, I don't even thinking straight.
Because that's the truth. Because of the pressure, the amount, and all that, I was not thinking straight. When I go to the accounting department, they just collected my file and take. After about 300-something thousand, you can't believe I paid less than 20,000.
Wow.
And the money I paid, I was made to understand. No, I think 13,000 something. It's less than 14,000 if I'm not mistaken.
So not even up to 20,000.
No, it's not even up to 15.
Wow.
So I paid, I think about 13,000 something, and the 13,000 something was, I think, while she was on admission, probably food or something. I think they give them food in that ward. So I think that's the only thing because she used a quite number of days.
Okay.
You know, that's on admission. So that's just. So immediately I left because I was sweating when I wanted to pay.
Right.
But immediately I saw that, I just laughed.
Please, let me just quickly take this. Let me quickly take this update. Hello. Yeah. Please go on. Yeah, please go on. Oh dear. All right, one of our traffic managers was about to give us an update. I guess it's as regards that earlier reported impediment. But do call back so we can get that. Please, Mr. Adeyanju, just so sorry about
it's okay, no problem.
Interrupting. You can go on.
So, you know, when I wanted to make payment, I was already sweating. Asking myself, because I started calling friends, transfer money to my account, transfer money to my account, transfer money to my account. So when I go to where I wanted to pay, they say, you cannot pay this. They will just cancel the payment. They cancel.
You even be asking them, what's happening?
As at that time, I couldn't ask questions. I was dumbfounded. You understand? I was dumbfounded. That was why I get to know this thing is quite real.
Wow.
You understand? Wow. So mainly, my friend was outside waiting for me. When I got there, I told him, I just hugged the guy.
Okay, Mr. Please just hold on. Let's take this. Hello.
Yeah, good morning. This is last man manager Bakari calling from Ikorodu Road.
All right, please go on.
Yeah, I just want to notify you and the Motor Republic that some Islamic group, they are on a peaceful protest, Islamic group.
Okay.
They are on peaceful protest around Ojota, moving towards Maryland on the service lane.
Ojota, it was Maryland. Okay.
Maryland.
Okay.
And it's called, they are causing backlog at the moment.
Backlog. Where's the backlog got into?
Still around Ganifa inside.
Okay, around Ganifa.
Before that tsunami bridge.
Okay, before tsunami, okay.
So, the Motor Republic should be patient because they are peaceful, no cause for alarm.
All right.
And policemen very much on ground with them.
Okay.
That's the information I have for you.
Thank you very much, Traffic Manager Bakari. Well done.
You're welcome.
Okay, there you have it. Piece of information for those of you navigating inwards Maryland from the Ojota end. I understand an Islamic group, they're having some sort of peaceful protest from the Ojota end inwards Maryland on the service lane, but because of that there's a bit of a backlog which is somewhere around Ganifayoimi at this time, just before the tsunami end. So please, as you head in that direction, just watch out for them and just take it easy. I understand security personnel and everybody is there, so just take it easy and watch out for them. Thank you so much. All right, we have Mr. Adeoju, who is an enrollee under the Ilera Eko scheme. Yes, and he's been telling us about his experience, very, very positive for that matter. And we also have with us Mrs. Meg Ogumushire, who is an enrollment officer with Lashma. So, I will be coming back to you, Mr. Adeoju, shortly. But of course, I just want to ask, so, ma'am, he spoke about the things he has benefited. Could you just give us a bit of details, these benefits? Could you enumerate them?
Okay. I'm so glad that he talked about
yes,
because when you talk about it to people, sometimes they're scared.
They think it's too good to be true.
It's too good to be, you're right.
That's the word.
But what they stand to benefit when they get to a hospital after they are enrolled, there's no need to pay for registration or consultation. Yes, a client called me that she bought into Ilera Eko, so she just wanted to use the facility before it's activated, and she was asked to pay 90,000. You can imagine that. So I told her, wait till your policy is active. You'll have access to those things. You don't need to pay for those things. So the consultation, if you go to the hospital now, you discover that to get a card, some hospitals are like 30, 40, 50,000.
Just for registration.
For registration. With Ilera Eko, you don't need to pay that. Once you have your policy number is active, you start using it.
Yes. Okay, so dear listener, we welcome your calls. You can start calling in 080-991-20777 and 091-538-77127. If you have any question, you have any inquiry, you can start calling in. We're also live on Facebook, Lagos Traffic Radio 96.1 FM. But of course, like I mentioned, we have gifts for the first 2 callers. We'll be recharging your phones with 1,000 naira. First 2 callers, 1,000 naira. This one no be shiri. All right, I have a caller. Hello. Good morning.
Good morning, Mr. Akan.
Yes, good morning. Your name and location, please.
Yes, my name is Dr. Busari.
Dr. Busari.
Yes, I'm interested in the program.
Okay.
I'm a retired civil servant.
All right.
62 going to 63.
Okay.
So my wife will be 59.
Okay.
With 3 children. My last one is 20.
Okay.
So I'm interested.
Okay.
So, what kind of package will this person recommend for me?
All right. So just listen over the radio. Of course, you are our first caller, so automatically your phone will be recharged with 1,000 naira after the show. Yeah, at the end of the show. Congratulations.
Right,
yes, please listen by the radio. All right, Mrs. Ogumushire, could you just respond to that quickly?
Okay, sir, what we'll do, we'll get back to you to tell you the plan you buy into, because yes, I think you'll be able to do standard plan because you have children less than 23 years of age. Yes.
Okay. So, Dr. Busari, they will be reaching out to you to, give you all the information you will need at the end of the show. How soon will that be?
Immediately
after the show. So, I have a second caller. Hello, good morning.
Hello, good morning.
This voice is very nice, sir. Who are we on to?
Okay, my name is Blessing. I'm calling from Bagada. So I want to, Blessing.
Yeah, please go on.
Okay, please, I want to ask, okay, I have a sister.
Yes.
Okay, I have 2 children and a sister.
Yeah.
So I want to ask, okay, can I add my sister under the family plan? Please, I want to know how to include her in the plan.
Okay, like a dependent kind
As a dependent.
Yeah,
Are you talking about
yes.
Yeah. How old is she, please?
How old is she?
She's 24.
Well,
Wow.
she can join yours.
She has passed the cutoff mark.
Yes, for the family. So she will have to stand on her own, which is 8'5".
Do you get that?
Oh,
Okay, so automatically you are our second caller. So your number, I've written down your number, and your phone will be recharged with 1,000 naira. Congratulations to you, Blessing.
All right, thank you. Thank you.
All right. Okay, yes, you can still call, Lou. You can still call. You can still call 080-991-20777 and 091-538-77127. You can ask your questions, make your inquiries, or general case, so we still have more callers. Hello, good morning.
Hello, good morning.
Good morning. Your name and location, please.
This is Mr. Yusuf from Lamelekom.
Oh, our regular caller. Good morning, sir.
Good morning.
Yes.
Yes. I will not stop commending the program.
Okay.
The Ilera Eko program.
Yeah.
But I will not hesitate to always present and my complaint all the time.
Okay.
Because I was at the hospital yesterday.
Okay.
So I discovered that it's like maybe you guys should cancel this individual plan and let us have standard plans so that although going to the hospital you get free consultation. I love that.
Yeah.
Because I hate going to patronize all these quacks.
Okay.
That one is even enough for for the individual plan. But I asked the other time that I need to move to standard plan, but the woman didn't call me back on your program last year, so I didn't get any. So when I got to the hospital, the same thing happened.
So you want to move? You want to move from the individual
yes,
to?
I'm not.
No,
yes,
I think sir, what you're trying to say is
you want to move from standard plus.
No, he wants to go from standard plan to standard
get
plus.
my boss completely.
Okay.
Because anytime I go there now, like yesterday and the other time I went there for the first time, I discovered that I was sent to go and get my drugs. That the drugs didn't cover my fund.
Okay.
So I prefer to stay. I love the program. It's very nice.
Yes.
So God will be with me, and I will continue to introduce it to people as I've been doing. But I don't need to hide my reservation.
Yes.
So that's it.
Yes. Okay. Great.
So
Thank you
I will
so
need
much.
somebody who will help me, to how to go about changing to standard plus.
Okay.
So
All right. Okay. So you need.
And again, I called the toll-free line. Is it not working on Sundays?
He wants to know the toll-free line.
It works. It works. Yeah.
Okay. What happened when you?
Maybe it was engaged or something.
Okay, I called to get my complaint, but nobody picked it. So.
Okay. All right. So let my guests respond, and they will definitely take your number. I believe this time somebody will reach out to you.
All right, thank you, sir.
Thank you so much. Do let us know what the outcome of all this is. Will you definitely reach out to us? Thank you so much, Mr. Olamide.
You're welcome.
Well done. Have a good. All right, 080-991-20777 and 091-538-77127. Would you want to add anything to that? Would you want to say anything?
I want to add to what he said.
Yes.
What is actually the policy is into is the same thing as standard plan.
Okay.
Family.
Okay.
He's only doing the one of individual.
Okay.
Yes. And if he had issues, that would be something that we're calling.
Okay, let's see if
it's
we
not
can
that
this
there's something
wrong or Hello, good morning.
Hello, good morning.
Good morning, Ilera Eko Extra. Who do we have on the line?
My name is Salami. I'm calling you from Mushin.
Salami from Mushin. Please go on.
Okay, I give the national order. Then my question is that why is it the cesarean section is covered and a drug of 800 naira is not covered?
What was did you have an experience where a drug of 800 wasn't covered?
Hello?
Did you have an experience? Could you tell us your experience? What happened?
Well, I purchased a family package from Lashma.
Okay.
So I used one of the hospitals. I don't want to mention the name because of that.
Okay.
So at times when we go to that hospital, you'll be wondering that 800 drugs is not covered. We have to pay. In terms of maybe you want to do blood test,
yes,
that is 5 or 5,000.
Yes,
that will be covered.
All right. Okay. So, Mr. That's just what you want to know. Okay, so Mr. Salami, now I will let you know how you can get to know what your benefits are, and then how you can reach out to them. Can you just listen over the radio? Is that possible?
Okay, I will listen.
Thank you very much, sir. Have a great day. So, so if there are covered benefits, and say, for example, the hospital refuses to give the enrollee what they are entitled to, what can such people do? Then how do they even know what they're entitled to?
Okay, thank you very much.
Yes.
Like what you just said now.
Yes.
If that medication is covered, and they're not given, they can make a call straight to the customer care line.
Okay.
Yes, from the customer care line. One thing we always tell them when they call, we tell them not to leave the facility.
They should call right there.
They should call right in the hospital. They shouldn't leave because yes, as the hot. Yes, they should call from the hospital. Okay. So when they call, we check from our end to know if that particular medication is covered.
Okay.
If it's covered, they talk to them to give them the drug. Sometimes they say it's not available and they tell them to buy. So if that is the case, that's a different thing. But when it's covered and they are not giving it to them, we tell them to call. They call, they purchase it. If they have to do it right there, they purchase. Then they send we have to have the doctor's prescription and we have to have the receipt. So they bring it to us at the outside. The money will be refunded.
Okay. Any numbers we can call for those who perhaps want to just reach out and make those complaints?
Yeah, so we'll give you, before we finish it, we'll give you the customer care line.
Okay, if we could just have it now. Okay, now we're just trying to pull that up.
I'll give it to you right now.
Okay, let's have it.
Okay, the customer care line is
0700, okay,
4537 2356
2356.
Yes.
Okay,
I go again, 0700 4537 2356
2356. Okay,
and we have another one.
Okay.
The first one is toll free.
Okay.
Yes, the second one is 080 045
3723
56
again
080 045 372
356. All right, it's been a great time on the show. So before we round up, I would like to just ask Mr. Adeoju. So seeing with all the good things you said, your experiences, and you told us about the kind of plan you are on. How long you've been on the scheme? That's like 2 years, thereabouts. More than 2 years, from 2020. Okay, and this is 2024, so a little over, say, 3 years thereabouts. What is your advice? Have you been able to bring people to?
Definitely I have.
What's your advice to Lagos residents who feel Ilera Eko is not real?
The first thing is I will commend the Lagos State government.
Yes.
For a laudable initiative, because I think they bring a quality health care closer to people who feel and they cannot afford such medical bills and all that.
Yeah.
So and I have advised Lagosians, there is nothing comes easy. Are you getting it?
Yes.
Nothing comes easy. So I will advise them they should key into this project because it's a government policy. So it's a continuation. It's not an individual policy. It's not a private policy where they want to make money. No. If you look at the amount you are paying and what you are getting, it is quite.
It can't be measured.
No. It can't be measured. Are you getting now? Imagine paying 40,000 naira for your family. Your wife give birth through CS. Your wife go to the hospital free of charge. Your children go to the hospital free of charge, including yourself. Consultation fee alone at a private hospital, we know what it costs now in Lagos. Or even not in Lagos, around the world. Sometimes the people that people that have problem with their eyes, they see an optician, they are given free glasses and all that, free drugs. So them to key into that project. It saved them so many costs, and it helps to help the family. That's the advice I have for them.
All right, thank you so much. Thank you, Mr. Adeyanju. Also, thank you, Mrs. Ogumushire.
Thank
you for coming today. We had a great time.
Thank you for having me
on the show. Yes, I will leave you with this. An Arabian proverb says, "He who has health has hope, but he who has hope and who hope has everything." So your health is your wealth. Make sure you get yourself on one of these plans and, protect yourself and your family. A big thank you to Victor Oteri. Also a big thank you to Deyinka Gbemigbade, PAO Lashma. Till we come your way next week, my name is Akan Usen. Bye for now.